To make your travel easier, we can arrange your airport transfer and hotel accommodation on your arrival date. On your first day of your treatment, you will have consultation with the doctor, and together with your partner, you will do initial tests which are required for IVF treatment.
I'd like to mention what happens after an infertile couple applies to an IVF center. There are some tests to be done prior to starting any treatment. The first test is the sperm analysis, which shows the sperm count, motility, and morphology of the sperm. If sperm analysis shows an abnormal sperm count and abnormal sperm values, men can be referred to an urologist.
İnfertil çiftin değerlendirilmesinde kadının yumurtlama fonksiyonları, anatomik yapısının değerlendirilmesi kadar erkeğin de değerlendirilmesi çok önemli. Aslında çok basit bir testle yapılıyor bu. Spermogram dediğimiz sperm analiziyle yapılıyor. Basit bir sperm analizinde çiftin tüp bebekteki şansını açıkçası kestirebiliyoruz. Spermin çok az olduğu, yapısının çok kötü olduğu durumlarda mikroenjeksiyon yani X uygulaması çok elzem bir uygulama. Normal şartlarda hiç döllemeyecek spermler tek bir spermin yumurtaya verilmesi sayesinde fertilizasyon sağlayabiliyor. Dolayısıyla gebelik oluşturulabilecek bir embriyo gelişmesine neden olabiliyor.
After the evaluation of men, it comes to women. The first test is vaginal sonogram, which reveals uterus and both ovaries. We can get some information by just checking ovaries. We count antral follicles. The second test would be hormonal analysis. We check thyroid hormones, prolactin hormone, and we do some analysis to evaluate in details the ovarian reserve. There are mainly two tests to be done to check ovarian reserve. There are FSH level and the AMH level, anti-Mullerian hormone level. After having all these tests done, we plan the treatment. Usually treatment starts on cycle day 2 or 3 because this is the first phase of the ovulation induction, first phase of the menstrual cycle. When we stimulate ovaries in the first phase, follicles respond to treatment and they start getting enlarged, getting bigger. Follicle tracking gives us invaluable information on the follicular response, on ovarian response, and we alter the dose of ovulation induction agents by just having this information by follicle tracking. Patients need to be monitored after starting using medication to induce ovulation. The main purpose is to get as many follicles as possible, but preventing ovarian stimulation. And meanwhile, I would like to get a good number of follicles to achieve best pregnancy rates. By using vaginal sonogram, follicular diameter as well as the number of follicles are measured. The aim is to get follicles reaching 17-18 millimeters in diameter. Once we get this diameter, the last injection, the last maturation injection is given to collect mature eggs out of follicle aspiration. 34 to 36 hours after the last injection, follicle aspiration or oocyte collection is programmed, is scheduled, and it's done under mild sedation.